webinar of this year, that is the International Day of Girl Child, organized by Yashwantrao Bhosle College of Pharmacy and Yashwantrao Bhosle College of D Pharmacy, Savantwadi, Sindhudurga, Maharashtra. Yes, I said it was the most awaited because when we were doing the planning in the NSS calendar, we were having so many plans for this day. Even our principal sir was very positive for this, and it was his idea to have discussion and conducting an awareness webinar on PCOS, that is polycystic ovary syndrome. Okay, now first of all, I would like to thank Dr. Bhakti Sawant ma'am, as when I called her for the webinar, she immediately got ready and accepted our invitation as our chief guest. I also thank all the dignitaries to accept our invitation and all the participants to register and join this, our virtual celebration program. On behalf of Yashwantrao Bhosle College of Pharmacy, I take this privilege to welcome all the dignitaries, our students, our teachers, NSS coordinators, and my dear NSS volunteers. Now we will have our traditional and auspicious virtual lamp lighting ceremony as a tribute to Mother Saraswati, the goddess of knowledge.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः कल्याणम् आरोग्यं धनसम्पदः.
Okay. Yes. Now I would like to notify you all that today's function has been divided in 4 sections. After this welcome section, there will be one technical section followed by best girl announcement session and then valedictory session. Let me begin by thanking few people, my parents, for not killing me as I am a girl, and I owe my life to them. Thanks to those thousands of women and men who fought races and battles to send their girls to the colleges, I owe my education to them. Thanks for my husband and in-laws for giving me the wonderful opportunity to complete my PG after my marriage and work here. So I owe my career to them. I feel myself very blessed because I born as a girl child and grown up as a woman. Over to this being a mother of a girl child, I feel myself very fortunate. The International Day of the Girl Child focuses attention on the need to address the challenges that girls face and to promote girls' empowerment and the fulfillment of their human rights. Now, on behalf of the whole NSS unit and all the NSS volunteers, I take this privilege to welcome wholeheartedly our chairman of NSS unit and principal of Yashwantrao Bhosle College of Pharmacy, also the convener of this event, Honorable Dr. Vijay Jagtap sir, who has been an inspirational and enthusiastic, versatile, meticulous, well-disciplined, but very stringent personality and the backbone of our YBCP college. I would like to request you, sir, to deliver the welcome address and welcome our chief guest and speaker of the day, Dr. Bhakti Dheeraj Sawant ma'am. Yes, sir. Over to you.
Thank you, ma'am. Hello to everyone. Sorry for delayed event. I'd like to welcome all the viewers and the participants who are joining us through the Zoom as well as YouTube. and especially I would like to welcome all the charming students of Yeshwantrao Bhosle College of Pharmacy. Let me wish you first a very, very happy International Day of the Girl Child. It was celebrated whole worldwide yesterday on 11th of October. Uh, Basically, it is very easy to say always to me or every, what you can say, particularly male dominant world, that we are not gender biased, or we wish all the girls and boys should be equal. We wish all the girls and boys should have the same standard, same ethics, same rights, blah blah blah. Always, it is quite easy. But have we understand the problems or issues related to the girls or related to the women's they are suffering from? Have we understand the issues they have to overcome through their life? Have we understand the some disorders and syndromes particularly are there, particularly to the females? So I think the answer is quite, I can say that it is no. So it was in my mind that in the last month of September, where it is the awareness program is associated with the PCOS, and whole worldwide it is celebrated the awareness month as a PCOS month, that is September. And one of my friend working is as a product management is in Corona Remedies Private Limited at Gujarat based industries. So he was talking that they are making lots of products related to the particularly women hygienic and disorders. And that time I came to know that PCOS is one of the major issue, or what you can say. I think I shocked when he said that out of 5 women in India, out of 10 women, 5 women are going through such type of syndromes, and particularly whole worldwide also the numbers are increasing. So that time I thought that we should do some awareness activity, and due to technical problem it is delayed, but NSS cell has activated me that we can conduct it on the day of International Girl Child, and so suddenly we have organized all this issue. So really, I'm very much grateful on behalf of Yeshwantrao Bhosle College of Pharmacy that Dr. Bhakti Sawant has accepted our very 11th hour invitation, and I think she will not only guide us to the issue of PCOS, but other than that, she will be there always with the Yeshwantrao Bhosle College of Pharmacy and YBCP family to always guide a student. So definitely, I wish that I'm very much proud to say that more than 60 to 70% students in the YBCP are girls, ma'am. So I think we should cover the what are the do's and don'ts through this PCOS awareness program. And I wish all the success for the today's event. And once again, I'd like to thanks all the participants, students, and other the viewers, and as well as Dr. Bhakti Sawant ma'am. And thank you very much.
Thank you. Yes. I also welcome our co-convener of the event, Honorable Principal of Yeshwantrao Bhosle College of Diploma Pharmacy, Sawantwadi, Mr. Satyajit Sate sir, and request him to guide us on this day by his ways.
Hello, good evening all. Wish you happy International Girls Child's Day. On the behalf of this occasion and on behalf of Yeshwantrao Bhosle College of Pharmacy, I am very much thankful to give me opportunity to say something on this event. First of all, apart from academics, this is organizing such type of lectures. Apart from academics, this is very needful, and this is a need of today's era. So for the all-round development of students. So I am wishing you all the best, and I am congratulate to NSS cell of Yeshwantrao Bhosle College of Pharmacy for organizing such type of beautiful event. So without taking much more time, I'm congratulated to all, and thanks to Honorable Dr. Vijay Jagtap sir for giving me an opportunity to talk on this. Thank you.
Yes. Now, before moving forward towards our technical session, we will just have a look on the video created by our NSS girls volunteers on the theme of the day. Yes, here we go. Just wait for a second. One second. दिसतंय का? आवाज येतो?
Yes, sir. Yeah, ma'am. It's visible. Yes. Very beautiful video highlighting the importance of the girls. Thank you so much, girls. Thank you so much. Now, it's my pleasure to extend a cordial and cheerful welcome to our renowned chief guest and an eminent keynote speaker of the event, Dr. Bhakti Dheeraj Sawant ma'am. Now, I would like to introduce to you our speaker of the day briefly. Doctor, she has completed her MBBS from Goa University, followed by MD in gynecology from Goa Medical College, that is Goa University only, with a diploma in obstetrics and gynecologic endoscopy. Ma'am received a training in gynecologic endoscopy from a world-renowned laparoscopic surgeon in Mumbai. She has traveled to Germany for advanced training in laparoscopy. At present, she is consulted at their own hospital, Bhakti Hospital and Maternity Home, situated in Sawantwadi, along with her husband, Dr. Dheeraj Sawant. So, with this short introduction of the doctor, I would like to request you, ma'am, to carry forward with the session of the webinar on PCOS, that is ovary syndrome. Yes, over to you, ma'am.
Thank you so much for your kind words. Yeah.
Yes, thank. Yes.
Thank you so much. Just a minute. Start with my scientific session.
Yes. You are sharing something, ma'am?
Yeah, I'll share something. Hello and good afternoon to all the eminent people and all the students. I'm thankful to Ma'am Ovi Paradkar for giving me a chance to spread some good information, and I hope everyone can hear me.
Yes, yes, absolutely.
Okay. So I'm really thankful to her that she gave me an opportunity to speak today. So today, as yesterday, it was celebrated as a International Girl Child Day, and last month was a PCOS awareness month in September. So I think both the opportunities have come together to give me a chance to speak on both the topics. So I'm really glad, and I'm happy, and I really like Ma'am Ovi Paradkar's introduction about herself, that the first line that she's thankful that she wasn't killed as a girl. So I think that is where the struggles of women start, right from birth, and they continue forwards. So I think all of us women can support each other and take us forward as women. So with this, thank you, and I'll start with my scientific session. I'll be sharing the document.
Yes, ma'am, any problem? You're sharing?
Just a sec.
Yes, okay. We'll wait.
I think I'll just screen share it because it's not getting uploaded. Yeah, okay, I got it. Can everyone see?
Yes, yes, madam.
Hello?
Yes, ma'am.
Yes.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay, thank you.
Yes, ma'am.
So today's topic is polycystic ovarian syndrome. And September was Polycystic Ovarian Syndrome Awareness Month, which is celebrated every year. So today I shall be speaking on that. So what is polycystic ovarian syndrome? Also known as PCOS. Earlier it was known as PCOD, polycystic ovarian disease, but now it's been known that it's not a disease, it's a syndrome. And this was first described in 1935 by Stein and Leventhal, and it's also known as Stein and Leventhal syndrome. So this is a syndrome. It's not a disease. There's a difference. So it's a syndrome is something that has symptoms, and it can present in many ways, whereas a disease is shows the same kind of symptoms in many people. So this syndrome, it is manifested by amenorrhea, which is the absence of menses or menstrual cycle or periods. Hirsutism, that is the growth of dark hair on the face and upper body, chest, breasts, back, and upper thighs in females. and obesity, that is body weight which is more than normal with the body mass index of more than 30. So this is associated with enlarged polycystic ovaries. So I shall be dealing with all these terms in the slides that I'll be presenting henceforth. So this is just the overview that polycystic ovarian syndrome has amenorrhea, wherein the girl doesn't get menses. She has hirsutism or growth of hair on the face, which is abnormal, and obesity, usually in many cases. And all this is associated with enlarged polycystic ovaries as seen on ultrasound. So it affects 4 to 6% of women in the reproductive age group. That is girls between 15 years to 45 years. So this is a large percentage of population, and why it is important is because though it affects 4 to 6% of women, many of them are undiagnosed and they remain undiagnosed. So this percentage, that is 6%, is definitely higher than what is recorded or known. So the exact cause of this PCOS is not clearly known, but obesity is the most common cause, followed by a genetic predisposition, that is, it runs in families. And so if your mother or your aunt or your sister have polycystic ovarian syndrome, suffer from symptoms of that, then you have a higher chance of developing it. Nowadays, PCOS is very common and very common in these girls today, of today's generation. First, because a lot of lifestyle changes, a lot of today's lifestyle is different as compared to girls of that age group, as 15 years would be, say, 20, 30 years back. The lifestyle is totally different now. There is a lot of sedentary lifestyle in these girls too. There is the play time that is given to these girls, or rather the girls don't play themselves in an outdoor setting. So the physical activity has decreased. The diet has changed. There is a lot of food being eaten, a lot of junk food, a lot of food, and stress. Stress real major role in today's generation. Maybe because almost the whole life is put on social media, and it gives them a inferiority complex, or maybe a complex of being left out, or basically everyone just wants to fit in. So this creates a lot of stress, and today's generation suffers from this stress. Even girls, not only girls, even children as young as 9 and 10 display of anxiety, which was not seen 40 years. So all these things, like stress, they all play a role in the PCOS being, the percentage being increased over the years, and also because the diagnostic facilities have increased now today. So what is it? It is a complex, in the sense there is no straightforward way that PCOS develops. It is complex. It is hormonal. It affects many hormones in the body, your sex hormones, estrogen, progesterone, the thyroid hormones, your lipid metabolism, is how you digest your fat. I'm sorry, I think there was a connection error.
Yeah, no issue, ma'am. You can continue.
Yeah, I shall share it again. So as I was saying, it's a hormonal syndrome. It's a metabolic disorder in the sense you have obesity involved with it. So you have other metabolic issues related to obesity like hypertension and diabetes mellitus, and it's a reproductive disorder too, because polycystic ovaries in turn cause anovulation, in turn cause infertility. In fact, it is the leading cause in female infertility. Around 20% of infertility patients have PCOS. So it can also lead to other serious conditions like that you have with related to PCOS. You have obesity, you have hirsutism, you have irregular cycles or amenorrhea leading to an inferiority complex in the person suffering from it, and depression, which is after that. So plus type 2 diabetes, that is non-insulin dependent diabetes, cardiovascular disease, and endometrial cancer. So I shall be touching upon these topics briefly, but dealing basically with PCOS and how it affects the girls in the age group between 18 and 25, as that is the age group of the people watching the program today. So PCOS affects 1 in 10 women. So almost 10 women, if you know 10 people, you may know one person who's suffering from PCOS. So it's quite common. So we need to know about it. So basically it has 3 things: amenorrhea, that is no menses, no periods; obesity, the person is fat in a general sense. So the BMI or the body mass index is more than 30 or more. Hirsutism is the abnormal growth of dark hair like in a male, but in a female, it is seen on the face, the upper lip, chin, upper back, upper chest, thighs, abdomen. So all these 3 things are the hallmark for PCOS, polycystic ovaries. So next time when you see a fat young girl, you don't criticize her because she might be in need of medical help. Is she gaining weight rapidly? Like someone you know, is she gaining weight rapidly? Is she troubled by facial hair, acne, irregular menstrual periods? And if someone you know is married and she can't become pregnant, so she may be a victim of PCOS. So we need to watch out for this. So to deal with PCOS or to understand PCOS, we need to know in brief about the menstrual cycle. So a normal menstrual cycle is about 28 days plus or minus 7 days, which is considered normal. So the first 5 to 6, 5 days, which can be again 3 to 8 days, that is when the menstruation or the shedding of the endometrial lining of the uterus occurs. So the uterus is the reproductive organ in the female, and it has an internal lining as seen over here in red. So that is the internal lining, and in the first, if you see towards the left side of the image, you will see it's shown as bleeding. So that is the lining that is shed during the menstruation, and then slowly the lining gets built up from the effect of the 2 hormones, that is estrogen in the first half of the cycle and progesterone in the second half of the cycle. So the first half of the cycle is before ovulation. So what is ovulation? Is showing both the components. The lower half is uterus, and the upper half is the ovary. So the right, I'll just go back to the first slide. So if you see this first slide, the organ in the center, bag-like organ, that is uterus, and ovary right and left. Now the ovary on the right side. Actually, the ovary on that side this is seen towards the left of your screen, towards the right of your screen, which shows small ball-like projections. That is a PCO, polycystic ovary.
Parab sir,
I'm really sorry. I think there's a network issue again.
It's okay, ma'am. It's okay.
Yeah, so I was saying, so the ovary on the right sections, that is your polycystic ovary. So I shall go to the slide that I was talking about. Yes, so now this slide shows the effects of the hormones estrogen and progesterone on the ovary and on the uterus. So in the first half of the cycle, the estrogen acts on the ovary and slowly one egg at the seen primary oocyte, one egg slowly develops and it becomes into a mature grafting cell, and then release itself. After ovulation occurs, the second half of the cycle begins, that is under the effect of progesterone and luteinizing hormone. So once the ovulation occurs, after 14 days later, the half of the cycle it is 40 days. The first half depends about 14-20 days. That is the ovary, and on the uterus, the estrogen in the endometrial lining, and then after ovulation, lining plateaus and off at the end of the cycle as menstruation. So this is in brief about the menstrual cycle, because I just wanted to show you this slide because I wanted to show you what's different in polycystic ovarian syndrome. So normally in one cycle, one egg develops, that is, it becomes big. It releases from the ovary. It travels through the fallopian tubes and into the. If pregnancy doesn't occur after 14 days, the women get her periods. So this is in short. See, in a normal ovary, there is a single follicle that matures, and then it comes out and becomes ovulation occurs and it reaches the uterus. But in a polycystic ovary, what happens is, because the hormone levels are not in sync, there is no proper correlation between the two hormones and the two stimulating hormones, that is the follicular stimulating hormone and the luteinizing hormone. These two are not in. So what happens is maximum size of 18 to 20 mm, after which it ruptures and the egg releases. So slowly, maybe 2 or 3 follicles develop. They reach maybe a size of say 8 to 10 mm, and then suddenly they stop growing. So all these follicles, they remain as immature follicles. So if they don't reach to a proper size, then ovulation doesn't occur and hence menstruation doesn't occur. So whenever the follicle matures, maybe after 1.5 months, 3 months, 6 months, 9 months, whenever, that is when the woman gets her period. So this happens in polycystic ovary. So what are the diagnostic criteria? This is for us doctors to diagnose patients which we think have polycystic ovaries. So this is based on the Rotterdam criteria. There are, the person has to have 2 out of the 3 criteria. One is oligomenorrhea, that means late cycles, more than 1.5 month cycles, that is more than 1.5 month gap between two menstrual cycles, and or ovulation. So and ovulation is so you have some cycles where you have delayed cycles, you have long cycles, or anovulation is where you don't get any cycles. So or amenorrhea, where you have no menstruation. So that is the first point. Second is hyperandrogenism, that is increase in the male sex hormone in a female. So females also have male sex hormones, but they are in a limited percentage in the blood, is 1%. That is the free hormone. So this is required for many things like your muscle building in females, or the sex drive in females. So this male hormone remains in that fixed percentage. But in PCO, it causes hyperandrogenism, that is the male sex hormone increases in a female, and this can lead to clinical changes, that is you have excessive hair on the face or dark hair on the face, or it can only show as biochemical changes. That is when you do a blood test, you realize that, okay, she has hyperandrogenism. And the third thing is polycystic ovaries, which is seen on ultrasound. As you can see the picture below, the black and white picture, the grayscale picture is the one on ultrasound. It shows the ovary like an egg, and those small black colored dark areas, round circular dark areas, those are the small follicles which have remained frozen in at that diameter. So they haven't grown, they have remained like that. So they keep on accumulating in the ovary. So these three criteria, these 3 points, the patient should have either two points amongst this. So what is the Rotterdam criteria is polycystic ovaries, anovulation or oligomenorrhea, that is late cycles, and excessive androgen, that is excessive male sex hormone. So how does PCO happen? Now this is a very simple flowchart that I have made. It is not so simple. There are many factors in this. But basically for y'all to remember, or rather y'all to understand, is what causes PCO. So it's obesity, genetic predisposition. That is, if you have a family, if you have a mother, aunt, sister who's suffering from it, you are most likely going to suffer from it. So there are some genes which are shown to affect, means shown to cause PCO, but it's not been proven. And there are receptor abnormalities, receptors for insulin. So either the insulin receptors, in the sense the molecules that can attach the insulin molecule to them, and then cause the insulin molecule to go within the cell, which helps in decreasing the blood sugar level after you eat, and which regulates in keeping the blood sugar levels normal and storing the excessive sugar in the liver. So this insulin has receptor abnormalities. Either the insulin doesn't attach to the receptor properly, or the receptor doesn't accept the insulin. So these 3 things are shown to be there in all PCO patients, but exactly what triggers PCO is not known. Secondly, for a patient, if she's been diagnosed as polycystic, having polycystic ovaries, she has had those ovaries since she was a fetus, since she was within her mother's womb. So it is not something that happens suddenly. It is something that she already has it. She already has polycystic ovaries from birth. But the only difference is, even though you have polycystic ovaries, around say 30% of patients have normal cycles, because they don't have the other triggering factor, that is obesity. If you have polycystic ovaries and then you become obese, it's most probably going to cause is going to trigger polycystic ovarian syndrome, giving rise to the other symptoms like amenorrhea, and hirsutism, acne, all those things. So all these things, obesity, genetic predisposition, and receptor abnormalities cause excessive insulin. And this insulin, it acts on the brain, the centers in the brain and in the ovaries. So these two things, brain and ovaries, each have their own hormones being released. So because it acts on them, the hormones that are normally released and in normal percentage and normal ratio, everything goes out of sync. It doesn't match each other. It doesn't match the menstrual cycle. So the ovaries are in a different cycle, the uterus is in a different cycle. So all this creates a havoc, and that's why there is no ovulation. The ovaries become polycystic, and there is an increase in the male sex hormone. So as you can see in the picture, these three wheels, they are all interconnected. So you have, the first thing is insulin resistance, which is the key point, which acts in the brain on the hypothalamic pituitary ovarian axis, and then it acts on the end organ, that is the ovaries. So these three things are interconnected. So that is the main thing. I hope everyone has understood that. Hello?
Yes.
Okay. So what are the symptoms? So you have ovulatory dysfunction, as I said, amenorrhea, that is no menses, oligomenorrhea, that is delayed menses, delayed cycles in 87% of patients of PCO. Irregular uterine bleeding, that is you have spotting before menses, or menses occur and then spotting continues for many days, or you have intermittent spotting between two cycles, like you have finished, the menses are over on day 6, day 7, suppose, and then you have spotting again on day 20, you have spotting in the sense little bit of bleeding on day 24. I'm just giving an example. So this is irregular uterine bleeding. So that happens in 26% of patients, and infertility in 20%. So infertility is a difficulty in conceiving, is a difficulty in becoming pregnant for women who have been staying with their partner for more than a year and practicing unprotected sexual intercourse. So if you have, there is no pregnancy at the end of 1 year or 2 years, then that is known as infertility, and 20% of these infertile patients have PCO. Okay. So as you can see on the picture on the right hand side of your screen, the first part is the normal ovulation. You can see the hormones that I was saying, FSH, LH, estradiol, so which help in the ovulation. There's the LH surge, which causes ovulation. And in PCO, there is no LH surge, there is no ovulation or infrequent ovulation. So this is the thing. Second symptoms are of androgen excess, that is increase in the male sex hormone in a female. So hirsutism. Hirsutism is the growth of, as you can see on the picture on the left side, it shows which all parts of the body in a female the hirsutism can affect the hairs growing on that part of the body. So normally in a female, you won't have too much of facial hair. You won't have hair on the chest. You won't have hair on the chest in the sense you won't have dark hair. That is called terminal hair. Everyone has fine, unpigmented or mildly pigmented hair, which is not easily seen, and that is lanugo. So everyone has that. But hirsutism is when this unpigmented or mildly pigmented hair becomes darker and coarser, becomes thicker, and that is why it is seen. This happens because of the male sex hormones which increase, that is androgen excess. So the sites are upper lip, chin, chest, upper arms, forearms, the back, abdomen, upper abdomen, the lower abdomen, below the below the navel umbilicus. You have upper thighs and lower legs. So all these places, hirsutism can occur, and there is a way to calculate a score which tells us how bad the hirsutism is, whether it is a mild, moderate, or severe case of hirsutism. So each of these areas are assigned points between 0 to 4, depending on the number of hair present in that area, the color, texture, how dark it is. So each of these areas are given points, and if you have total points of more than 8, then you have a moderate degree of hirsutism. Okay, so all these things are for us doctors, for y'all to take home the message of hirsutism. To understand hirsutism is the hair that grows, which is dark, which is thick, and it's seen, and it is not normally seen in these areas in females. Okay, so you can see in the picture, hirsutism seen on the face. You have the side locks, which are dark, plus if you see on the cheeks and on the chin and on the neck, you will see in a beard-like fashion the growth of hair. The picture below that is of the abdomen, which is showing growth of dark hair just below the navel. This is a typical male pattern distribution of hair, a triangular distribution of hair below the navel until the your pubis. So this pattern of hair is seen in males, but this is of a female, which is showing hirsutism. The picture right next to it is again showing a beard-like growth of hair in a female. And yeah, so the second point is acne. So again, the androgen excess causes increased secretion of sebum, that is oily material from the sweat glands on your face. So this increased production of oil or sebum blocks the openings of these sweat glands, and that is why they get the secretions get blocked. There is a bacterial growth in it, and then you get these acne. Again, there are degrees of acne from mild to severe, purulent, which have pure pus-like discharge coming from it. So acne, usually acne occurs in adolescents when they hit puberty, that is when they say 12 to 13 years. Acne does occur in most adolescents. This is because of changes in the skin, increase in oil production. But the acne associated with PCO is much severe than what you would normally see in a adolescent girl or boy. So this acne is more difficult to treat, because when you treat only the acne, it decreases, but you're not treating the cause for the acne, which is the increase in the sex hormone. So once the treatment stops, or once it reaches a certain point that, okay, you have decreased it to so much, it won't decrease further, because you're not treating the main cause of it, that is the male sex hormone excess in the body. So acne. And the third thing is alopecia, that is hair loss or baldness, that is complete hair loss, which is of the androgenic pattern. So hair loss is normal. There is a normal percentage of hair loss for each and every one, male or female. But the androgenic hair loss in a female is has a certain pattern. So you have the temporal, that is if you consider your scalp between the head, so you're on your right and left side, you will have loss of hair in those areas, like a normal male pattern loss. You will have that kind of a loss, and the loss of hair on the crown. So these things are seen in females. So if you have hair loss which is throughout, like there is no certain spot that you're losing hair in, that is not mostly related to PCO. If you have PCO, the hair loss will be in these certain areas, like you have a temporal hair loss and you have hair loss on the crown. Okay. So these three things. Then third is insulin resistance. In the sense, there is resistance, there is no binding of the insulin to the insulin receptors. That is called insulin resistance. And this causes acanthosis nigricans, that is dark, brownish to blackish, thick kind of a film that appears on the nape of the neck, that is the back of the neck, the underarms, and your inner thighs. So it causes skin changes. And the second thing insulin resistance causes is obesity, which in turn causes insulin resistance. So it is a vicious cycle. So going to the next slide, the other symptoms in PCOS can be dysmenorrhea, that is period pain, or you have really painful periods. Most of the polycystic ovarian syndrome patients don't have this symptom because they don't have ovulation. Most of the times, the periods that occur or the cycles are anovulatory. In the sense, ovulation does not occur. Only thing, the lining within the uterus, the endometrium, it grows to a certain point, and then the vascular or the blood supply cannot maintain this lining, and that is why it sheds off and you get your periods. So not necessarily if you get your periods that has ovulation occurred. So you can have anovulatory periods also. Okay, so dysmenorrhea is an uncommon symptom of PCO. Other symptoms are deeper voice. So you have voice changes, which happens because of excessive male hormone. This is really troublesome because once the voice has changed, it is next to impossible to get it back to normal. So that is why we need to identify, and these patients at an earlier stage identify that this patient has polycystic ovaries and has androgen excess before all these permanent changes occur. So there is a decrease in the breast size, again because of excessive male hormone. There is pelvic pain because of the polycystic ovaries. The ovaries increase in size. They become cystic in the sense they become fluid filled. So they become heavy. They fall down into the pelvis, and it secretes fluid into the pelvis, that is the lower part of the abdomen, the inside part of the abdomen. So all this causes pelvic pain. Sleep apnea is associated with obesity. Because of obesity, there is increased fat tissue in and around the neck. So sleep apnea is when the person sleeps, the tongue, normally everyone's tongue falls back into the back of the throat, but this does not cause a problem in people who are not obese. But in people who are obese, because this tongue falls back and there is excessive fat tissue in the neck, the area left for the air to go from your nose down into your lungs is decreased. So what happens is this causes a decrease in the oxygen that is supplied, that can go into the lungs, and it causes a decrease in the blood oxygen levels. So this is sleep apnea. The last part is depression, which is a symptom which is overlooked, or rather not picked up by many doctors, and patients themselves don't open up to the doctor saying that okay, I have so and so stress, I am not able to do my daily activities, I am not interested in enjoying my daily activities, enjoying school, college, or with my friends. Basically the person is not interested to do anything. So that is a symptom of depression, which has to be asked if the patient is not. Is there a network problem, ma'am?
No, ma'am.
No, ma'am. No, ma'am. Continue.
So depression needs to be asked by us. We doctors need to ask patients if they have any stress, if they are suffering from any anxiety, because that is a trigger for PCO. And patients also need to, girls need to come forward and say that I am not feeling okay. I am not okay. This is not me. This has to be told to your doctor without feeling any shame or guilt or being shy. So this is the thing. So why is polycystic ovary to be diagnosed, and we should know about it and we should treat it early, is because of the long-term risks it carries to the patient. So when you have polycystic ovaries and obesity for a long time, you're surely going to get diabetes, because there is insulin resistance, and insulin is very important in diabetes, as you all must be knowing. So you're definitely going to get diabetes. Maybe when what you would have got after 40 years, you'll get at 25, 30 years. Plus all that obesity, all uh, the obesity and the problems in the lipids or the fat that is being digested, metabolism, all that, all the fat that is left in the blood goes and coats all the arteries inside, which blocks the arteries to the heart, and then you have heart disease. You have hypertension, that is high blood pressure, because all these, there is increase in cholesterol which blocks the arteries, so you get high blood pressure. Dyslipidemia is the same thing. Your lipids or the fats, they are not in the proper range. So this is with the blood. Then you have endometrial cancer, that is the cancer that is of the internal lining, the endometrium of the uterus. So this happens because the endometrium grows too much, because there is no hormone regulating it. It grows too much. There is irregular shedding. There is excessive growth of the endometrium. So all these things causes changes in it, which can lead to cancer. Breast cancer, again, because of the same thing, hormonal imbalance. All these hormones, the out of sync hormones, cause changes in the breast tissue, which can lead to breast cancer. And recurrent pregnancy loss for a woman desiring pregnancy, because the same hormones are the ones that help in pregnancy. So even if she gets pregnant, because the hormones are not what they should have been for a pregnancy, she is most likely to lose that pregnancy. So these are the long-term risks. So we need to really uh, diagnose and treat polycystic ovaries. Uh, Patients, women, girls need to know about it, so they know that, okay, so what I have may be a symptom of polycystic ovaries, and I should consult a doctor, or I should tell my parents or guardians or whoever, and we should, they should go and they should take the patient to a doctor, and so that polycystic ovaries can be diagnosed or ruled out. So the diagnosis is on based mostly on the patient history. So for this, the patient has to give a proper, accurate history. So we ask them about their past health, if they have suffered from say any health problems, any menstrual irregularities, any increase in bleeding, decrease bleeding, what are their present symptoms, what are they suffering from now, the family history, whether they have the same history in their mother, aunt, history of epilepsy, that is seizure disorder, because the drugs used for treating this can cause amenorrhea, that is you won't get your periods. So there is no PCO, there's nothing. It's just because of this drug, it's a side effect that the patient is not getting her periods. TB, tuberculosis, again, because it decreases, rather it affects all the cells, your whole immune system. The drugs that are used for tuberculosis, and tuberculosis per se as the disease affects the whole body. So usually menses stop when the person is suffering from tuberculosis or is on anti-tuberculosis treatment. We ask for history of breast discharge, that is a white discharge from the nipples, because this is a sign of increase in another type of hormone called prolactin, which causes this breast discharge and which causes amenorrhea, that is patient doesn't get menses. So there is a different reason for not getting menses. It is not polycystic ovaries, it is hyperprolactinemia, that is increase in the prolactin. So we need to know about this too. And history of weight gain, as I said before, stress. So all these things have to be asked, and the patient has to say anything if they have any other symptom. In physical examination, what we see is the body weight of the patient and the height. It is measured body weight in kilograms and height in meters. And then we calculate the BMI as weight in kg divided by height in meter square. So if you get this, when you can do this, if you get a value of 30 and more, it is obesity. 25 and more is overweight. 25 to 30 is overweight, and 30 and more is obesity. The blood pressure is measured to see if there is high blood pressure. Even in a young girl or woman, this has to be done, because this is not age related. This is because of PCO. So you should measure the blood pressure. So rule out galactorrhea, that is the same thing, breast discharge, milky discharge from the breast. That is a cause for, that is because of hyperprolactinemia. Body hair distribution. If there is abnormal distribution of hair, the thickness pattern, all these things are seen if there is hirsutism. And as I said before, the scoring is given. The name of that score is the modified Ferryman and Galway score. So that is for us to score it. The third thing is the laboratory tests that are done, blood tests. So you have a complete blood count. We see to see for hemoglobin. If hemoglobin is less, is if you have anemia, you can have loss. The thyroid function tests, because if your thyroid hormone level are low, then you will not get your periods. If your prolactin levels, if they are high, again you won't periods. Fasting blood glucose to see your insulin sensitivity, your glucose tolerance test or HbA1c to see the resistance levels. That is the male hormone. So that's what I was talking about. So normally the Sorry, I shall continue.
Yes, please.
Yeah, sure.
Yes, so I was saying testosterone levels. So normally the free testosterone levels in a normal patient would be 1%. In PCO, it's usually 2%. Then the serum FSH and LH, that is follicular stimulating hormone and luteinizing hormone, on day 3 of the menstrual cycle. Serum progesterone, that is another female hormone, which is seen in the mid-luteal phase, that is the second half of the menstrual cycle. And the lipid profile tests are to be done. There are even more tests to be done, but these are the basic tests that we do. The fourth thing is ultrasound, which is one of the most important things to be done. So, and pelvic ultrasound, that is the ultrasound of your pelvis, the lower part of your abdomen, to see for the ovaries, whether they have follicles, there are multiple follicles, and what are the sizes of the follicles. And also we do an abdominal ultrasound, that is the upper part of your abdomen, that ultrasound to see for the liver, whether that person has fatty liver. because there is a problem in the digestion of fat. All this fat gets accumulated in the liver, which and you see this thing on an ultrasound as a fatty liver. So all these things have to be done. These are the basic things that have to be done, okay, for the diagnosis. So what are the goals of management? So what do we want is we want to decrease the patient's androgen levels, basically, because that is creating a havoc everywhere. So we decrease the androgen levels. We need to protect the endometrium so that she doesn't get cancer. The patient needs to do lifestyle changes for a normal body weight, because even studies have shown that even if you decrease 5% of your body weight, if you're overweight or obese, and even if you manage to decrease 5% of your body weight, most probably your periods will become regular. All your other things, your polycystic ovaries will decrease. They won't go away completely, but they will decrease. Your other symptoms, your depression and your hirsutism, once that has occurred, it will not decrease, but you won't get a new growth of hair. So all these things really work even if you decrease 5% of your body weight. So that is to be done. So that is the goal that the patient has to achieve. Avoid risk of cardiovascular disease from all these changes of obesity and lipids, diabetes mellitus, that is diabetes, and patient should achieve pregnancy. So the management is the general management, the medical and surgical. So general management is weight reduction, as I said, the diets. Like the diet, there are two parts to weight reduction. It's not only diet, there is diet and exercise. It's a two-pronged approach. So diet and exercise is equally important. You can't only do diet and expect weight loss, or you cannot just do exercise and expect weight loss. You have to do both the things. So diet in the sense does not mean eating less. Diet means eating smart. So what you need to eat is fruits, vegetables. You need to have your daily intake of proteins too, but have them as good proteins. If you're a vegetarian, you can have sprouted lentils. That is a very good source of proteins, a bowl a day. If you're a non-vegetarian, a good source would be eggs. Eggs are the excellent source. Eggs every day, 1 or 2 eggs every day, or fish or chicken. Red meat, that is mutton, beef, pork, all these things have to be avoided because that increases your cholesterol. Okay, so the higher percentage of your food should be fruits and vegetables, and only 1/3 of your plate should be proteins. You have to have regular meals. I really need to stress on this point, because even in my practice, what I see is young girls coming to me, oh, I feel giddy, I feel dizzy, I have pain in my stomach, I can't eat, I feel gassy, I feel bloated. And I ask them only one question: do you have your breakfast? And majority of them, more than 90% of them, tell me, no, we don't have breakfast because we don't get time, or we don't want to eat, or whatever. So what I want to stress is on regular meals. You have to have your breakfast. The breakfast is the most important meal of the day. That is what kicks your metabolism. If you have breakfast the first thing in the morning, your body, your brain, your mind, everyone knows that, okay, I'm getting my calories, I'm getting food, I don't need to do anything else. I'm getting food, I'm going to digest this food. And your metabolism is at a normal level. But if you don't have breakfast, your body goes into what is known as starvation mode. Your body, your mind, your brain thinks that, oh, I am not going to get any food. Whatever food I'm going to get next, I have to store it because I am starving. My body is starving. So whenever you eat, obviously you need to eat sometime. So if you don't have the breakfast first thing in the morning, if you have breakfast say 3, 4, 5 hours after waking up, When you eat that food, your brain is going to tell, oh, I need to store all of this. So whatever you eat, everything will be converted to fat and stored in your liver, under your skin, in your blood vessels. So all this, it's a big vicious cycle. So regular meals, proper interval of eating. You shouldn't remain hungry for more than 5 to 6 hours. So all these things. So regular meals is the second most important thing. Avoid processed food. Processed in the sense whatever you get in a packet. Your breads, biscuits. This is for, I'm saying, for a polycystic ovarian patient who needs to lose weight. Okay, so you have to avoid. Normal girls, obviously, no one can just stop eating all these things. I'm saying avoid. In a patient who is like obese, they need to really stop these things till they come to a normal body weight. So processed food, anything you get in a packet, which is processed, like you have bread, biscuits, you have chips, which is salty, you have fried food, again chips and other fried food. Fried food eaten at home is okay once a week, but fried food from outside is a no-no. And a calories restricted diet. So you eat properly, you just decrease your calories every day. This has to be done under the guidance of a dietitian. So a dietitian will see the person's weight, height, and calculate the BMI and how much that person needs to lose to come to a normal BMI, that is between 15 and 25. Sorry, 18 and 25. So the dietitian calculates that how much the person needs to lose in kilograms, and depending on that, how many calories you need to decrease from your diet every day. So if you're having, say, 2000 calories per day, and if you're just overweight, the dietitian may say, okay, you don't need to lose too much. You need to decrease your calories by, say, 500. So instead of having 2000 calories per day, you need to have 1500 calories per day. So those have to be smart calories. You have to have your calories from complex carbohydrates, like your home cooked chapatis or your bhakri. You can have rice in a limited quantity in the afternoon so that you burn it throughout the day. Then you need to have a daily intake of good protein, as I said before. 8 glasses of water, that is around minimum 3 liters of water per day. If you have less water, again, the same thing is going to happen. Your digestion will go haywire. Nothing will get digested. Everything will get stored. So water. So water is again important. Many young girls don't drink water. I don't know, maybe because they don't want to go to the washroom or the washrooms are not proper, whatever, but water has to be, you have to have 3 liters of water. That is not only for digestion. Everything is dependent on water. Everything, all your blood pressure, your digestion, your kidneys, everything is dependent on water. So 3 liters of water every day, a calories restricted diet, as I explained. Exercise is anything that you like. Moderate exercise. You have to get tired by doing this exercise, and you have to do it 30 minutes a day and 6 days a week minimum. So 30 minutes a day in the sense that you exercise for 30 minutes and then sleep the rest of the day, that is not going to work. You have to do moderate exercise 30 minutes a day, and you have to stay active. As I said, in lifestyle changes, you have to stay active. You have to start walking. For small chores, keep walking. If you have a two-wheeler, don't use that. Go walking maybe. Okay, so you have to do all this. Again, a dietitian or a trainer, a physical trainer, will be able to guide you better for what kind of exercise you need to do. You have to be focused and you have to be consistent. You can't do exercise one day and say, oh, I will do it after 3 days. No, that is not being consistent. You have to remain focused. This is a long-term thing. You can't expect to see results in 2 days. You will have to do it for 2 to 3 months, and then you will start seeing results. Another thing is stop smoking. Lifestyle changes. I don't know what is the percentage of people who smoke. There is no study. So maybe it is more than what it used to be earlier. younger population has started smoking earlier these nowadays. So I don't know the exact percentage, but if you're smoking, stop smoking. That is the thing. That's the general management that has to be done, and this general management is the basis of your treatment that will help in treating this polycystic ovaries from at the base. So that has to be done, and it has to be followed throughout your life. The medical management is just to aid in this basic management. So like you do all these things, you exercise, you diet, and then we will give you treatment. Medical management will doctors will give you tablets to regularize your cycles and to treat the hirsutism and acne. And in case a woman doesn't want in case a woman wants pregnancy, then we shall treat that woman with another line of treatment. So depending on whether the woman wants pregnancy or not, the treatment differs. So usually the first thing that is given is hormonal contraceptives, or which tablets which have the two hormones, estrogen and progesterone. And if you have hirsutism and acne, then we add another hormone to it, that is cyproterone acetate. So that is there. The second thing is metformin, which if you have impaired glucose tolerance, means you don't have diabetes, but you are just one step away from diabetes. Or if you have type 2 diabetes, that is non-insulin dependent diabetes. So that is when metformin is given. And clomiphene citrate or letrozole in case of infertility for patients to help them to conceive. So that is the medical management. Surgical management is when the ovaries become so cystic that they are painful. The cysts are big, and when they rupture, there is a lot of fluid which accumulates in the abdomen, which causes pain. That is when the surgical management is indicated. It is not routinely done because there are side effects to it. If what is done is ovarian drilling, that is the cysts are punctured physically during the operation. So that can decrease the ovarian reserve, in the sense that can affect the normal eggs too, the follicles too. So that is why this is not done. So surgical management is a last resort. The first thing is your basic management, the general management. Then for hirsutism and acne and morbid obesity, we have cosmetic surgery, like bariatric surgery to treat morbid obesity. You can have gastric banding, that is a band is applied around the stomach to decrease the size. Or you can have gastrectomy, which is not usually done now. It was done earlier, that is to cut the stomach and make it small. That is not done now. Electrolysis and laser treatment for hirsutism, like you can read on the left is electrolysis. That is, the needle is inserted into the hair follicle and a current is used, it's passed, so that it destroys the base, the root of the hair follicle. And in laser, a light source is applied without the needle, and it is sufficient to penetrate to the base of the hair follicle, and it causes the hair follicle to fall off. So it can, so these two things, these treatments have to be done under the guidance of a proper skin specialist who's trained for these things, as these treatments have their own side effects. As you can see at the end, you can have pain, scarring, repeated treatments required, or it can cause pigmentation if overdone, or it can cause scarring, it can cause thinning of the skin. So all these things are there. So all these treatments have to be done after consulting a proper skin specialist. So what is the conclusion? These slides, they were an attempt by me to show that the importance of this syndrome in a woman, not only in the reproductive age group, but because the serious consequences that it may bring about when ignored or not treated, like cancer and diabetes and cardiovascular disease, heart disease. So with awareness about this syndrome, we can easily fight this disease. I shouldn't have used disease, I'm sorry, but we can fight this disease because I was thinking about all the other things that polycystic ovaries cause. And I hope everyone over here they have gained some information from this presentation, and they will spread this basic information in the community in general and help those who are suffering from this syndrome. And first thing is, no one should ignore the symptoms. No one should tell you that, no, this is normal. This is all normal. Nothing has happened to you. If you feel that this is not normal for you, then you should come forward. And let's treat at the earliest. That is for us, doctors. Let us treat at the earliest. So we don't say, come, you can come after 3 months, you can come after a year. Let's see if it resolves on its own. No, let's investigate. Let's see if you have polycystic ovaries, and let's treat you at the earliest. So September last month being the PCOS awareness month, there is a lot of things going on online and everywhere for creating awareness. Let's hope that this presentation helps everyone over here. And take-home message is help those who have polycystic ovaries. Tell them to come forward. And I think that's it. Yeah. Thank you for your attention. It was lovely to give you this talk. Thank you.
Yes. Thank you, ma'am, so much. We will have now the questionnaire session. Anybody wants to ask any question to our doctor, please, you can ask. You can unmute yourself, okay, and ask the question. Yes. Yes, so madam, one is asking, one of the participants, that is it a genetic disorder? Yes. Presentation, yeah. Is it genetic? Yes. The next question.
Okay.
Yes. Is it a genetic disorder?
Yeah, I can read it. Ma'am, is it a genetic disorder? So first of all, thank you for everyone. Nice presentation, excellent presentation. Thank you. I hope you liked. I'm really thankful that I'm glad that you liked it. I was worried that it would be too scientific and I would go too much into details and it would really everything would just all the information would go above their heads. But I'm happy that everyone understood. And yes, it's a genetic disorder. There are some genes that are involved, but it's not proven. So it's usually even if you're genetically predisposed, what really triggers polycystic ovaries is obesity. So I think that should be the take-home message. Treat obesity. Anyone else?
Yes, one. Yeah.
Hello, ma'am. Yeah, there was a question before that whether it is related to thyroid. In the chat box, there was a question that whether PCOS is related to thyroid.
It is not related in the sense, but what happens is they are interconnected. So if you have thyroid, if you have hypothyroidism, that is your thyroid hormones are less, it will cause a decrease in your metabolism, which will affect how you metabolize the fats, how you digest the fats. So the fat digestion is affected, which causes obesity. And if you have polycystic ovaries, or even if you don't have polycystic ovaries, it can trigger them to form polycystic ovaries. Polycystic ovaries in turn cause insulin resistance, which in turn causes obesity. And now this whole thing is a vicious cycle. So this whole thing is interconnected. I hope I have answered the query.
Okay, ma'am, there is one more question.
Yeah, sure.
It was asked while taking the registrations, okay, of the participants, that one of the students have asked, my periods are going 5 to 10 days ahead than a normal day. Why it is so? And I am not having any other PCOD like disorder.
10 days? I didn't get the question.
Yeah, I'll repeat the question once again. She has asked that, yes, her periods are going 5 to 10 days ahead. Yes, yes, and what is the problem? Why it is so? And she is not having any PCOD like disorder.
I don't think it is related to PCO. So 5 up to 8 days is okay. Even 10 days is okay. If every cycle the patient gets a periods 10 days late every time, then it's most probably not polycystic ovaries, but thyroid and prolactin levels have to be checked to rule out that it's not caused by thyroid or increase in prolactin levels. So that needs to be checked.
Yeah. Hello, ma'am. Yeah, there was one more question in the chat box from Madhura that whether we can reduce the androgen level by having changes in the diet.
Androgen levels per se cannot be directly decreased, but changing the diet to a proper diet will help in stopping the what do you say, or the androgen levels will not increase further. Obviously, once the androgen levels have increased, they need medical management to decrease the androgen levels. So that is for a short period of time. So once the treatment is over, to manage the levels at a normal level, diet and lifestyle changes is what is required.
Anyone else?
Okay, so what type of treatment is suggested for polycystic ovaries? Symptomatic or asymptomatic? Okay. So I think what she's asking is, even if you're asymptomatic, do you need treatment? So I said around 30% of polycystic ovaries patients have normal regular cycles. So they're asymptomatic. They don't have anything, but they have polycystic ovaries. So for them, if on a regular ultrasound, if an ultrasound is done uh, for any other indication and polycystic on the ultrasound, there's nothing to be done for the polycystic ovaries, but a thyroid profile, a thyroid test has to be done. Prolactin levels have to be checked, and your sugar levels or your insulin level has to be checked if in case the patient is obese, so that these other things can be ruled out. So you can have androgen excess and you can have metabolic disorder without having polycystic ovaries. So that has to be done. So even if the patient is asymptomatic but is obese, um, or has polycystic ovaries on ultrasound with other blood test abnormalities, then that patient has to be treated. Yes, irregular periods is also a sign of PCOS. As I said, oligomenorrhea is usually long cycles, irregular cycles.
Yes, okay. Okay, ma'am. To conclude, let me briefly restate the points and summarize the lecture. Madam has clearly told about what is PCOS. PCOS is a polycystic ovary syndrome. It is not a disease, but it's a syndrome. In this, there is amenorrhea, hirsutism, and obesity with enlarged polycystic ovaries, and it is found in 15 to 45 age of girls. And obesity is the main cause, and lifestyle, diet, stress. Okay, these are the main causes. Uh, this is the causes of this like metabolic disorders and hormonal imbalance, some reproductive disorders. This leads to female infertility, anxiety, depression, type 2 diabetes, cardiovascular diseases, okay, and endometrial cancer also. So 1 in 10 people, they are affected by the PCOS. So hallmark main causes or hallmarks for this PCOS is amenorrhea, obesity, and hirsutism. Hirsutism is the facial hairs are found, and obesity is a weight gain, and amenorrhea is no periods at all. Madam also explained very well the menstrual cycle of 28 days and anatomy of the uterus. Then what is polycystic ovary and a difference between the polycystic ovary and a normal ovary, androgen, which are the hormones which are involved in the this estrogen, progesterone, and luteinizing hormone. Then diagnostic criteria about the PCOS. It is on the Rotterdam criteria. First is oligomenorrhea, that is the gap between the cycles, or delaying the cycles, or long cycles, that is a anovulation. Then hyperandrogenism, that's a clinic. It can be, this leads to clinical, or it can be biochemical also. That's an increase in the male hormones, that is which is of 6% normal in case, which increases, okay, in case of the PCOS. So in this case, hair on the face, or hair on the face, or it can be found, or a blood test can be also done for biochemical diagnostic. Then polycystic ovaries with the exclusion of etiologies, like you can say that polycystic ovaries, anovulation, and excessive androgen, these are the main 3 criteria for the diagnosis. Now, the main triggering factor, Madam highlighted continuously, that obesity is the main cause, okay, of all this, like genetic predisposition or receptor abnormalities. These are the reasons, and this leads to excessive insulin, which acts on the brain, ovaries, and this leads to no ovulation, polycystic ovaries, and increase in the male sex hormone once again. And all this can lead to polycystic ovary, and polycystic ovary can be by birth also. Symptoms, under symptoms, ovulatory dysfunction, then androgen excess. In the androgen excess, hirsutism and acne is found. Then other symptoms like dysmenorrhea, deeper voice, decrease in the size, pelvic pain can trigger the PCOS. So this has to be diagnosed because it can cause to long-term risk like diabetes, heart disease, hypertension, dyslipidemia, and even to breast cancer, recurrent pregnancy loss, and endometrial cancer. So for diagnosis, a patient should tell to the doctor, or he should convey to the doctor about the patient history, like past health, present symptoms, then menstrual history, epilepsy, if there was a TB, this can cause to loss in the menses. Any breast discharge, like a prolactin is breast discharge, which is found, and weight gain. Lab test can be done to diagnose the PCOS, like CBC, thyroid function test. serum function test, serum prolactin test, ultrasound, and pelvic ultrasound to see the ovaries, abnormal ultrasound to see the liver, etc. Now the management, how you can manage this, madam nicely advised that regarding the management, like first is the decrease in the androgen levels, decreasing the androgen levels, protect the endometrium, lifestyle changes should be done, body weight should be controlled, and avoid cardiovascular diseases and achieve the pregnancy. In this, there is a general management like weight management, proper diet, and incorporating fruits and vegetables in the meat, exercise, active lifestyle. Second is a medical management is there where special treatment is given the drugs like metformin, clomiphene, citrate, and hormonal contraceptives. Surgical management is also the option where the cyst is when the cyst is ruptured. In that case, laparoscopy ovarian is done. Then it is not routinely recommended this surgical management. This is the last option or left with the doctors who treat. Then one more option is that is cosmetic surgery. There is laser treatment is there, electrolysis, and bariatric surgery. So the lastly, madam nicely highlighted that first we should not ignore all these things, all the symptoms. If you're finding out all the symptoms, you should first you should not ignore them, and you should go for treatment as earliest, because anything is not normal. Everything has one reason. Yes. Now, once again, I would like to thank Madam Dr. Bhakti Sawant.
Thank you.
For valuable this lecture and knowledge. Now we'll go for the third session, that is the announcement of the best girl child of the year from B Pharmacy. And I would like to request Dr. Bhakti Sawant ma'am to announce the name. Yes, ma'am.
Yeah.
Yeah.
Hello.
Yes.
Yes, ma'am, you can continue. Yes.
Hello.
Yes, yes, madam.
Yeah.
You're audible.
So I would like to announce the best girl child for this year. She's from final year, and she's Amita Parab. So hearty congratulations to Amita Parab for winning this best
Thank
girl
you, ma'am.
child of the year. So I would like
Yes, Amita, are you
Thank you,
there?
ma'am. Yeah, I am there.
Yes, your name has been chosen on the basis of your special achievements and dedication in the academics and in social activities by playing various social responsibilities,
Thank
roles and
you.
responsibilities. Like she is an example of the woman entrepreneurship. As a student, I noticed her as a very active girl, very enthusiastic, and with all the qualities of the like business woman, as she used to do the photocopies of all the notes at home for the students also, and in academics also she is among the first three ranks. Right now she is the owner of the Amita Pharmacy, then owner of Medicare Clinic, director at Amita Pharmacy and Distributors Private Limited. Recently we had organized a mega health camp where we were engaged in the camp organized at Nandanagari by NSS unit in collaboration with the Medicare Clinic at her premises. So today was the last day of the mega health camp, and I really wanted to appreciate her because she is handling the her work also with the B Farm course also, and already she is proceeding with the her degree course. Like she is already the pharmacist now, and everything she is managing. Yes, Amita, are you
Yes,
there?
ma'am. Yeah, I'm there.
Yes, I want to ask you one question, like how you're doing all these things as a student,
Oh,
how you're handling these things, and also
as
you
a
are in the top three ranks also.
yeah, as a student, it is very difficult to handle all the things. It goes very tough, but because of the capable staff, I'm able to do this, as well as my family support.
Yes, what message you would like to give to our child girl, or all the girls, or all the ladies, women?
As a girl, all those girls who are listening out here, I just want to tell one thing, that do something which gives you your name. आई बापांनी एक नाव दिलेलं असतं, लग्न झाल्यानंतर दुसऱ्या नवऱ्याचं नाव लागतं, बट स्टील मध्ये जे असतं ते आपलं अस्तित्व निर्माण करण्यासाठी असतं, सो ते करावं प्रत्येकाने.
Yes,
थँक्यू.
very appreciating. Once again, congratulations, Samita.
थँक्यू मॅम.
Yes, I would like to play a small video, a very small video. It's created by our NSS students, girls. Just watch it. Very short video it is. आवाज नाही येत आहे.
Deserves happiness. Every girl deserves education. Every girl deserves a quality of time.
Every girl deserves respect.
Every girl deserves peace. Every girl deserves enjoyment.
Every girl needs to be appreciated.
All girl deserves the right to speak.
Every girl deserves to be pampered.
My voice for our equal future.
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 My voice for an equal future. voice for our equal future.
My voice for our equal future.
Start.
My voice for our equal future.
My voice for equal future.
Yes, all the girls, they are taking action, finding their voices and expressing their visions for an equal future. This day of the girl come together online to celebrate their talents and accomplishments. If effectively supported during the adolescent years, girls have the potential to change the world both as the empowered girls of the today's and tomorrow's workers, mothers, entrepreneurs, mentors, household heads, and political leaders. An investment in realizing the power of adolescent girls upholds their rights today and promise a more equitable and prosperous future. Girls are breaking boundaries and barriers posed by stereotypes and exclusions. As entrepreneurs and innovators, initiators of global movement, girls are creating a world that is relevant for them and for the generation. Yes, with this note, I would like to request Saidi Madam to give the vote of thanks.
Good evening to all the dignitaries and audience. I am Ms. Saili Padwar. It gives me immense pleasure to thanks on this occasion of International Day of Girl Child. It is a day to highlight the needs and problems they face. The theme of this year's Girl Child Day is My Voice, Our Equal Futures, which is highlighting the efforts to be meet these needs and fulfill our rights. So I wish you all happy International Girl Child Day. First and forever, I thank to God for making this event memorable. Now, on behalf of Yashandra Bhosle College of Pharmacy and Yashandra Bhosle College of D Pharmacy, I wholly heartily thanks to our speaker of the day, Dr. Bhakti Sawan, who blessed us with her inspiring words and valuable guidance, also for sparing your valuable time. Thank you, ma'am, for your advice of daily breakfast can help in overcome among problems. Further, I would express my gratitude towards our management for gives us a good platform. I wholly heartily thanks to our Honorable Principal of Yashandra Bhosle College of Pharmacy, Dr. Vijay Jagtap Sir, and our Honorable Principals of Yashandra Bhosle College of D Pharmacy, Mr. Sate Sir, for their support and guidance to make these events successfully events. I also extend my thanks to the NSS coordinators and students volunteers. Further, I thanks to all the delegates for your valuable presence. I hope this program will help us to make out a voice whenever needed. Finally, I leave a quote with a spelling GIRL. G stands for give her life. I stands for invest in her education. R stands for raise her as an equal. And L stands for love her unconditionally. Thank you all once again for listening me patiently. Thank you.
Yes, thank you, ma'am.
Yes, sir. Yes, ma'am. Can we appeal for common photograph, please?
Yes. Are you all ready? Yes. Just one more second.
Please announce.
Yes. Done. Yes, Sandesh, are you clicking the pics?
Hello, ma'am. Not everyone started their videos.
Yes, I would like to request all of you, please put on your videos for the photograph. Yes, Sandesh, quickly take the photographs.
Yes, ma'am.
Okay.
Okay, ma'am, participants are asking for your feedback link, okay?
Yes.
Please let them inform the whatever the
Yes,
details.
so feedback link will be sent on their registered mail IDs, okay, and on the chat group also, WhatsApp chat group. Thank you so much. Shall we leave the meet? Yes. We are closing this. You can leave the meet.